Here we go. Excellent. So welcome to today's Globe Talk in honor of World Health Day 2024, which was earlier this month. Our topic today is naturopathic medicine in today's world. And this session is brought to you by the Global Engagement Team at the Community Solution Education System. The Community Solution Education System and our schools are committed to preparing innovative, engaged, purposeful agents of change who serve our global community. Our team works to bring this mission to life by providing leadership, infrastructure, and support for internationalization throughout the TCS community. We are passionate about creating learning opportunities that have a positive impact on our global community. Our Globe Talk series is part of our global engagement mission and provides virtual year-round discussions to introduce the community to thought leaders in higher education, experts on key functional areas, best practices, and the diversity of ideas necessary to expand our own internal strategic thinking. Before we begin today's Globe Talk, I'd like to go over a few tips for best accessing this session. We ask that you please mute yourself throughout the presentation, but feel free to use the chat box and reactions throughout. We also recommend keeping your video off in the interest of conserving bandwidth. As we all know, technology can sometimes be finicky. As the speaker is presenting, we will be monitoring the chat box. We do have a lot of time for a Q&A session at the end of the session, but feel free to pose your questions or comments throughout, and we will address those at the end. As I mentioned, technology can be finicky, so please be patient if anything does go on. We will do our best to fix any situations that arise. And should there be any issues, all Globe Talks are recorded and will be available after the session. I would now like to introduce our speaker. It is my absolute pleasure to introduce Dr. Marcia Prenguber. Dr. Prenguber is Dean of the College of Naturopathic Medicine at the University of Western States in Portland, Oregon, where she developed the new naturopathic program. She is a board member for the Oregon Association of Naturopathic Physicians and has served on multiple boards and committees in integrative medicine in the past. She has served as the Director of Integrative Care at the Indiana University Health Goshen Center for Cancer Care, was an executive board member for the Connecticut Naturopathic Physicians Association, and president for the Naturopathic Medical Education. Dr. Prenguber was a founding member of the Naturopathic Postgraduate Association and served on the editorial board of 2 naturopathic journals. Before going to naturopathic school, she was a teacher and then an administrator in the field of special education for many years. She's also lived in Japan for a few years and traveled throughout Southeast Asia for 1.5 years while there. It is my absolute pleasure to now turn it over to Dr. Prenguber. I will stop sharing, Doctor, and you can start sharing your screen.
Thanks. There, can you see my screen?
Yes, you're perfect.
All right. Wow, nobody's told me I'm perfect for a very long time.
Although I think we can see your notes.
Okay, that's not the one we want. Let's try this one.
There we go.
Okay.
Perfect.
So you see just the slides, yeah?
Yes.
Great. Okay, let me just move this. All right, so I am really excited to talk to you all today, especially those of you who don't know anything about naturopathic medicine. I think it's an interesting field, but I'm also very passionate about it. So I would say it's far more than interesting to me and all of my colleagues in the field. Really today, this is in honor of World Health Day, which happened technically on April 7th, but it's really a month-long celebration. And it is Earth Day, so it ties it all together. Just as a little background, because we will talk about the World Health Organization. The first World Health Assembly was in 1948, and it marked the founding of the World Health Organization. They have a specific theme each year. The theme this year is My Health, My Right, to basically say everybody has a right to health support and services, information, education. So yeah, let's just move on because that's not the most interesting part of the topic of naturopathic medicine. All right, there we go. All right, so naturopathic medicine is, and this is the American Association of Naturopathic Physicians definition. We'll talk a little bit more about it, but it's a distinct primary healthcare profession, which emphasizes prevention, treatment, optimal health using the therapeutic models and methods and substances that encourage an individual's inherent self-healing process. And we'll talk more about that self-healing process. It includes the use of modern and traditional scientific and empirical methods. We integrate all the biomedical understanding of health and disease, applying biology, biochemistry, physiology, pathology, pharmacology, all of the clinical sciences, as well as traditional approaches to health care. Naturopathic physicians, so let me back up just for a moment. I say naturopathic physicians here in the state of Oregon. We are licensed primary health care physicians. The regulation varies all across the world, and we'll talk more about that. But because of that, some people in the field are called naturopaths, and others are naturopathic doctors, based on what the regulation says wherever they are. So while we focus on prevention and chronic disease, we do address acute conditions and those in need of palliative care. Our profession is guided by really two philosophies of vitalism and holism, and we'll talk about that, and 6 principles, which we'll go into detail about. Rather than tell you all what we're going to do, let me just start doing that. All right, so the history is, it technically originated in Germany in the late 1800s as a very basic European style of medicine. However, the roots of both the philosophy and the principles goes back thousands of years and uses healing practices from many different cultures. As you can see, Indian, Chinese, Greek, Arabic, Egyptian. It's a broad range that we draw from, and pulling the best from all of them. All of them, however, have in agreement this concept of an understanding that the body has an innate ability to heal. We call that vitalism, as well as the idea that you need to address the whole body, not just the physical body, but the whole person. And all of those cultures have that understanding. That's the common component among them all. So when treating someone, you have to treat the whole person, not just the chief concern that the patient comes in with. The term naturopathy was really originated back in the late 1800s by Dr. Scheele in New York City, interestingly enough, to describe how he was addressing patients. And then in the early 1900s, Benedict Lust began to use the term to describe his, use of many different modalities in treatment. So it's something that has evolved over time, over hundreds and hundreds of years, but the term is really only in the last 150, slightly over 100 years. Let me see, next slide. All right, so the principles, we have the two, vitalism and holism, but now let's get down to the 6 principles that really guide us in what we do. First, do no harm. So we say avoid suppression of symptoms when appropriate. Probably the most common example given here is someone develops a fever. Do we instantly just give them something to reduce the fever, a Tylenol, an aspirin, and Advil? From a naturopathic standpoint, we're not going to address that fever from a suppression standpoint unless it's out of real need. If it's a slightly high fever, the fever has a job to do, causing a reaction, and we'll get into some of that later. So we try not to suppress the symptoms unless they are really in need of that. We also use methods and substances that minimize side effects. There are lots of ways to address various conditions. We're always trying to use the least invasive, least toxic approach, the one that causes the least side effects. It's sometimes a challenge to get there, but always pays off when we can. We move from the least toxic, least invasive on into more invasive procedures as the need arises. We also look at the healing power of nature, the inherent self-healing process, which goes along with that concept of vitalism. The body has an organized approach to healing. If you cut your finger, the body instantly, pretty much, comes to start the healing process, starts that inflammatory cascade, releasing chemicals, which stop the bleeding, the tissue repair, right? That's an example. Fever is another one. Fever has a job to do, so we want it to do its job as long as it doesn't cause us an effect that's not a healthy one. Vomiting and diarrhea are very simple and basic things. When you have consumed something that you shouldn't have from a food poisoning standpoint, then that's going to, your body instantly reacts to that. Or fractures, if you break a bone, but it's aligned by a physician, then the body starts to heal that fracture naturally. Those are all just examples of that self-healing process. All right, identify and remove the underlying cause, treat the cause. Sometimes we can remove the cause, sometimes we cannot. But if we're looking at why this person is sick, we're going to go for everything we can in terms of figuring it out. So sometimes it's as simple as lifestyle behaviors like nutrition or exercise or the lack of exercise, eating behaviors, hydration. You know, for how many decades now we've been telling people to drink more fluids, but the fluids have to be the right fluids. Alcohol is a fluid, but it's not the right one. So just your own posture, how your rest. When do you take time to relax? What are your sleeping habits like? Those are lots of things that can be changed. But there are also other social emotional issues that can be changed. How people deal with their environment in terms of social life, whether it's in the workplace, in the family, or friends. How they respond to that. You can't just say, dump your family. Let's figure out how to work with that. Environmental influences like the air, the water we drink, how the soil is in terms of the plants that we consume, chemicals, heavy metals, all of those exposures. Let's see, treat the whole person. Well, again, we're back to that holism concept that somebody comes in, they don't just come in with a symptom. They may present as just a symptom, but if we dig down, we find that there are many other components to it. So, and that goes back to identify and treat the cause. We're tying those together. Doctors, teachers. So this is an interesting one. Naturopathic doctors tend to take this one and run with it in ways I just find remarkable. I read a statistic the other day that said 96% of naturopathic physicians do public education. They have done it sometime in their life. It's amazing how many continue to do it after they've been in practice for 20 or 30 years. It's not just about trying to draw in patients, but rather educating the public. So we're educating them on how to first do no harm is one example. But there's so many settings in which we can do this. It's not just about an individual patient, but also about the public at large, if you will. Prevention. So assessing risk factors, heredity, susceptibility, all leading to appropriate intervention. So we're trying to help people through that doctor as teacher and first do no harm, how to improve our lives so that patients take more responsibility and understanding, help to understand what it is that they can do that will prevent the disease from coming on or worsening. All right, so the therapeutic order is one of the guideposts posts that naturopathic physicians use, and you see they are in an order. So first is to establish the conditions for health. So looking at removing those obstacles to health: poor diet, stress, digestive disturbances, not enough rest, toxic exposures, all of those things. Moving on to stimulate the healing power of nature. Again, that self-healing process, understanding how the body works. And there are many theories that we look at that. Typically, it's common for someone to see a skin condition and try and treat the skin. Sometimes that works, but just as often not, it comes from a more internal place, that the skin is just the presenting symptom, but is not the cause. So we have to understand how the body works and work with it to help the healing process. Address weakened or damaged systems or organs. Okay, so if you have and this will lead right into the next one, my first example, something that is out of line and needs support from a manipulation, or like chiropractic manipulation, naturopathic manipulation, osteopathic manipulation, some massage, and so forth and so on, trying to correct that structural integrity. But there are many other weakened or damaged systems that we look at. So you want to support that, but there are some cases in which, for example, an endocrine system, right? So you may need to address that endocrine system either through lifestyle. Sometimes we can, when we look at someone with blood sugar levels that are out of whack, way too high. It could be that their diet can correct that, but it could also be that we're moving forward onto addressing the pathology where substances such as insulin, needs to be incorporated into it. But there are lots of ways we can address some of those weakened systems with some of the methodologies and the modalities that we use with botanical medicine, with homeopathy, with nutrition, mind-body counseling, and so forth. So correct structural integrity, we kind of talked about that. Address the pathology. So again, using natural substances whenever possible, the modalities or interventions that we use, such as botanical medicine. Again, going back to the endocrine system. So in places where we have the prescriptive authority, we might then use replacement therapy. So someone who is hypothyroid, trying to support that with thyroid supplementation. All right, address the pathology, use specific pharmacologic. Again, here we go with the pharmacologic or synthetic substances, and then ultimately suppress or surgically remove. And we're moving down the path now of other conditions that are in need of those, well beyond what we can do from a botanical, homeopathic nutrition, lifestyle behavior. So we can talk about cancers in that way, some cardiac diseases in that way. So, all right, let's move on. All right, naturopathic assessment. We'll see a couple of slides on this here. We treat patients throughout the span of their lives. So we have some naturopathic midwives who bring those infants into the world, but clear through to death. So I have many classmates who work in hospice from a naturopathic perspective, and everything in between. So just a little bit of a review. We want to determine the factors that contribute to the state of health, the positive and the negative, and make sure we're focusing, moving the positive forward. The symptoms of disease and the underlying causes. What is the ultimate cause of that? We'll get to that a bit more. Oh, I was trying to think of the name of Erin Brockovich this morning on my way in. Just comes to me now, the movie where she just kept digging. She's not a naturopathic physician, but I think she would have made a great one, until she figured out what the cause was and then fought to fix that. So we gather information to make the correct diagnosis using the biomedical and traditional diagnostic methods. So we use all of conventional medicine's approaches, but use some more naturopathic approaches, which probably make it a more time-consuming process in terms of assessment and patient appointments. And those are figured into the process so that we get all the information from the patient. When we, the naturopathic program here at the University of Western States incorporates the all of the curriculum of the Institute of Functional Medicine. And one of the things that functional medicine does is when they take a patient history, they go back to the patient's birth and want to know the history through that. And when we talk about it, we're not just talking about medical history, but we're talking about life history as well, what the living circumstances were, who the people were involved, what the person's emotional history has been. All of that gets incorporated. So it makes a great structure and helps to figure out really what's going on. So then we're looking at what the patient's vitality and state of well-being is. And we do this in more conventional medicine, I think, as well. We just don't identify it quite as well. Where is the patient? What can they tolerate? Where do we need to go? Is their vitality really from strong from a physical standpoint, but not from a mental health standpoint? What can they tolerate in terms of what we're moving forward with? So here's another piece of that assessment. So it's patient-centered for sure. It's all about looking at the patient as an individual who needs help from a health standpoint. So we call it person-centered. We assess the patient's health status, which we just talked about. We identify the factors contributing to the patient's symptoms and/or diseases. And this takes a bit more work to keep inquiring with the patient. Sometimes I found that the patient is not always quick to understand why we're doing this. So we need to explain that all of those components help to contribute toward identifying what the factor is, what's the cause. All right, assessing the vitality and well-being, as we just talked about. And then really, we need to look at what the breadth of the assessment can be done by the naturopathic doctor and what needs to be referred out. I've worked in states where there is no licensure, and we're going to get to that later. I've worked in states where there's licensure but no prescriptive authority. And now I work in a state where we have licensure and broad prescriptive authority. And you just have to learn how to work with and collaborate with other providers to make this happen. In the state where there is no prescriptive authority, but a license, the naturopathic doctors work closely with other primary care physicians so that every time they want to make an adjustment to medication or make a recommendation that would interact with whatever it is the primary care physician has prescribed, there needs to be close contact and collaboration on that patient's part. So it's going to vary a lot, even to what labs, can you order labs? Can you order diagnostic imaging, let alone medications? So we'll talk about that again. All right, so here's just a little pictorial summary, if you will. The personal and health history, as I said, it really going back and getting detailed information makes all the difference. Diet and nutritional status. So, you know, we ask people to tell us what their diet is like, and would be very uncommon for someone to be completely truthful about this, right? People tell you what they think you want to hear. So we work at that closely. But it's not just about what they consume. It's about when they consume it, how they consume it. You can tell me that you are eating a lot of zucchini, but if it's deep fried zucchini, it's a different story, right? So we're taking a look at all of those components. Exercise and lifestyle factors. Some people will over-exercise to the detriment in terms of not having enough support there. Mental and emotional status, how well are they coping? How much stress do they have to deal with? Environmental exposures, we see a lot of that when we talk about mold as one example. Physical exam, and we will go above and beyond in terms of looking from a physical exam standpoint. For example, a nutritional physical exam tells us something that all the labs in the world it may support, but may not give us a clue to look into that. And then laboratory and imaging studies. Let's see. All right. So the modalities, the therapies that we use, and I'll tell you right off the bat, applied nutrition and lifestyle counseling are the most common ones used across the board, not just here in North America, but around the world in different ways, but generally, I would say I think I read over 90% of all NDs, that's where they start. Clinical nutrition, or the application of supplements, right? So when we tell someone to take vitamin E, vitamin C, zinc, whatever it is, we want to make sure they're also taking quality nutritional supplements. And that makes a big difference, because I've seen people say, well, I can get it cheaper on Amazon, and it didn't do anything. So we want to look at, well, let's try this other approach in terms of the vitamin C or the vitamin E or whatever it is I want you to take. Botanical medicine can be taken from internally, right, as a tincture, as a capsule, as a tablet, as just in a food, but it can also be used from a topical standpoint, to application as a cream, in a compress, as a lotion, inhaled as well. You've all heard of aromatherapy. All right, so we use aromatherapy with some botanicals. Hydrotherapy, which is one of the earliest ones that we see throughout all of those different cultures of medicine. Hydrotherapy is one that shows up all the time, and they're typically hydrotherapy tools that can be applied at home by the patient, some in the clinic, but generally in the home. So homeopathic medicines are used probably more in some cultures than they are in others. I would say India is a home of homeopathy. There's quite a few NDs in North America that use it as well. Physical medicine includes all the things that you can think of, from naturopathic manipulation, but also massage, laser, all kinds of things like that. Mind-body medicine takes different formats. Maybe meditation, maybe breathing techniques, Tai Chi, Qigong, yoga, biofeedback. All right. Pharmaceuticals are really used probably more in North America by naturopathic physicians than in other places in the world. And certainly in those locations, obviously, where they have pharmaceutical authority. Prescriptive rights. And I think it varies a lot from one group of naturopaths to another. Acupuncture, again, this is also restricted from a regulatory standpoint. In Oregon, for example, NDs do not practice acupuncture. You need an acupuncturist license. In other states, you can practice acupuncture as a naturopathic physician. We certainly see acupuncture used in those regions in the world where it has originated. We'll talk about that a little bit more. Ayurvedic medicine, again, the same thing. You'll find a few in North America, but it's predominantly used in India. Yoga, I think, is used more around the world than in other locations, than other modalities. I'm sorry. So, yeah. All right. Let me just move on. I'll be here all day if I don't. Okay. So let's go back to the World Health Organization, which is really what prompted this whole World Health Day. It's a wonderful concept, and it's very late in coming from my perspective, but it's here and it's helping. So in 2023 in August, I think they had all the G20 leaders. They had people from 88 different countries, health ministers, practitioners, those representing very traditional practices in healthcare, meeting in India for a couple of days, and committed to really bringing evidence-based traditional, complementary, and integrative medicine to improve the health of all peoples. So WHO regions, and I bring this up because some of them are a little, they weren't as obvious to me. This is called the regions of America in the red. All right. In the pink, that is considered the European region. And you can see that includes all the way through Russia. The blue is the African region, but not all of Africa. So just keep that in mind as we go through some of the slides coming up. That yellow, green, I guess I'll call it yellow, is the Middle Eastern Mediterranean region. And then next to that is that light green color, not to be confused with the turquoise. And that light green is Southeast Asia. And that really comprises, you can see obviously India because of its size, but also Sri Lanka, Thailand, the People's Republic of Korea, Indonesia. And then you get to the turquoise, which includes South Korea. So they've separated those out. And Australia, New Zealand, and many of those other countries that we think of when we talk about Southeast Asia. But so we'll see those again in a minute. Here we go. So I tried to help put the two together. So the European region, which is that pink again, is considered the traditional home of naturopathy. And there are over 30 countries in that region that have naturopaths, I'll say. In the region of the Americas, which is quite a large region, naturopathy was introduced in the late 1800s, so brought over from Europe predominantly. The Western Pacific region, which you'll recall, is over here in the turquoise, has had a naturopathic workforce since only the early 1900s. The Southeast Asian in the green was introduced, naturopathy was introduced in the 1920s via India. And India, I think, really it's from the European countries through India, and then it spread there. And in Africa in the mid-1900s, so it's actually not all that long ago that we see that. And then in the Eastern Mediterranean, in that yellow region, only since the late 1990s as a general rule. In all of these countries, 108 of them, only 34 countries have some form of statutory regulation that then says what an ND can or cannot do. 75% of the countries in all of this, in the WHO regions, use the term naturopathy, and the people practicing it are called naturopaths. In only 41% are called naturopathic doctors or naturopathic physicians. Ben spent some of my time in practice in states where there was no licensure or a restricted licensure. I really now like to make the point here in Oregon that we are naturopathic physicians, not just naturopaths. I shouldn't say just. Okay, so the global practice of naturopathic medicine. So we know that in the European region, it's been over 200 years. There are 30 countries with 60,000 naturopaths practicing there. In the region of the Americas, it is only second to the European region, but big second. There are 30 countries, which was quite remarkable to me when I read that. 25,000 naturopaths or naturopathic doctors, both terms are used here. It's considered the home of modern naturopathy, with the education becoming the most advanced here in North America. In North America, many states are considered primary care physicians, but not all over the US. And certainly, this is where NDs are leading the naturopathic research in Canada and in the US, doing more research than in other parts of the world, although I would say Europe and Australia are doing pretty good jobs there as well. Southeast Asia naturopathic medicine was introduced in the 1920s via India. There are 5 countries there, 10,000 naturopathic physicians or doctors. And in India, naturopathy is recognized by the traditional system of Indian medicine. So it's a part of their traditional system. So it's well accepted. Yes, when I was in India and in need of healthcare, I was sent to this clinic and treated and resolved the health issues remarkably quickly, but I didn't really know what I was being treated with. As it turns out, it was homeopathy in a naturopathic clinic. So that's how I got my start in naturopathic medicine. Western Pacific, introduced in the early 1900s. There are 14 countries there, Australia being probably one of the largest in terms of the number of naturopathic physicians practicing there. And they've contributed quite a bit in terms of research into naturopathic modalities. And then we have Africa, the mid-1900s, only 13 countries in. Remember, we're talking about the African region. Sorry, I said Africa here. 5,000 naturopaths there. And in the Eastern Mediterranean, only as late as the 1990s, and 8 countries there. All right. So this is the interesting part to me now, naturopathic education. By who region again? So there are 131 naturopathic educational programs globally, which really surprised me when I read that statistic. You'll see here, we'll go over this, that it doesn't necessarily match the size or the number of NDs. 38% of the programs are in Southeast Asia. 27% in the European regions. 22% in the Americas. Gets more interesting as we go because we'll see how that reflects in the Americas. In the Western Pacific, 9%, and in the African region, 4%. The modalities used, as I said before, dietary changes and lifestyle modifications are definitely at the top of the list there in terms of what's used around the world. Nutritional supplements, 64%, which was a high percent, I thought. But herbal medicine, I would have thought would outrank that because the herbs used around the world. I once gave a couple of lectures at an oncology conference in Turkey and talked about, one of the presentations was about the herbs that the people in Turkey are using when they are told they have cancer. And so they use everything that they possibly can find to help. Obviously, they're still seeing oncologists, according to the research that I've read. And they're using all kinds of herbal medicines. And so I was presenting this to a group of medical oncologists who were totally, really unaware of what patients were doing on their own outside of what was being recommended, whether it was chemotherapy, immunotherapy, and so forth to treat their cancer in Western medicine. They were really shocked. And I said, this group of herbs are fine if they're taking these particular chemotherapy agents. They're not okay if they're using these and so forth. And these, under no circumstances, should they be using it all? And they really had no awareness that their patients were A, doing any of that, or B, the interactions. And I will just say that from a interaction standpoint, naturopaths are probably better versed than most practices in terms of interactions with herbs, supplements, and medications. All right, back to mind-body counseling. We've talked a little bit about that in terms of yoga, tai chi, meditation, biofeedback. Manual therapies would include muscle release, massage, physical manipulation. Acupuncture, and I use this term broadly here, includes needling, auricular acupuncture. Acupressure is included by some groups. Cupping, moxibustion. Okay, hydrotherapy we talked about. And that really is the application of water for therapeutic purposes. It could be alternating hot and cold. It could be the use of one or the other that can make quite a significant difference. It's used to be sedative in acute diseases as a general rule and stimulative in chronic conditions. Okay, homeopathy, the use of homeopathic remedies. We won't get into that. That's another whole topic on its own. All right, so then let's go to the types of programs globally. So remember, there were significant percentages in some of those regions where I was a bit surprised. The doctoral level training programs are over 4,000, I think, in the US and North America. There are certainly over 4,100 hours, more to the 42 or 4,300 hours. It's 52% of all programs, and they're found primarily in North America, in Asia, predominantly in India and Western Pacific. I would venture to say predominantly in Australia. The practitioner level training programs of 2,500 hours are found in other regions and continents: South America, Africa, Europe, Eastern Mediterranean. What's interesting to me is that if we look at 52% of all programs are 4,000 hours, and then we go back and figure, I think it was, let me see, programs, 22% are in the Americas of 131. Then I think it's in this next slide. Maybe it's not in the slide. It's not in the slide, but of the ones in North America, there's really one school in Canada with 2 campuses. And then there are programs in Seattle, Washington, La Jolla, California, Portland, Oregon, Tempe, Arizona, Lombard, Illinois, and Gurabo, Puerto Rico. So it's a small number of programs. So here in North America, so there are quite a few programs elsewhere. I'm not as familiar with their programs at all. All right, so in these, in terms of regulation, as I said before, only 34 countries have some type of regulation for the practice of naturopathic medicine. 75% use the term naturopath, 41% use the term naturopathic doctor. In the US and Canada, the training is all at the doctoral level, and it's regulated by the Council on Naturopathic Medical Education. In India, it's regulated by the Central Council for Research in Yoga and Naturopathy, because those two are intimately linked. So just to bring us back to the US, I've tried to stay global, but there are some things that I think will be more interesting to, I think, all of you. From a standpoint of regulation, you can see that the green is where there is regulation, or in a couple of those greens where there's an R, they're in the process of developing those regulations. In the pink area, there's active licensure initiatives, but you can see that it's not spread across the US as certainly I would hope it to be. And there are some states that really have very little movement there. The states are getting it together, but it'll be a while before they get licensure passed. And then if we look here, the scope of practice, and I include this one because this is about prescriptive authority. In, for example, the state of Connecticut, there's licensure but no prescriptive authority. If I want to change a patient's approach to controlling their blood pressure, for example, using some botanicals and diet and exercise, I can't touch that lisinopril, their blood pressure medication, because I don't have prescriptive authority. So every time we make a change, the patient has to go back to their primary care physician for to titrate down that medication. It makes for good rapport and collaboration and integration, but it's a problem for the patient to have to always be seeing multiple providers for each slight change. So let me see the next one. This is just about ordering labs. So if I go back to this, you'll see there's not a whole lot of difference, but it's hard to make diagnosis when you cannot order the labs yourself and you have to send the patient back for labs to be done elsewhere. So we're working on that, but it is a challenge. So naturopathic practice. So this is just to get you back globally. 5.5 million naturopathic patient visits per month. Should probably be 50 million, but we need to get the practice out there. On average, this, I would say this is true. 4 different naturopathic therapeutic modalities or practices are used in every naturopathic visit. So they might be told to change their diet, to get a little bit more exercise, to try a supplement and maybe a botanical medicine. The challenge that we have in the educational programs is that the student wants to use everything that they've just learned and have the patient do 20 different things. So it's always about keeping a level head about it. Common things, as I said before, we treat a broad range of conditions that a patient has. We're treating those patients for maybe 1 or 2 or more conditions, but these are probably the most common. So they might come to see a naturopathic physician to decrease the risk of cardiovascular disease, for treatment of an existing cardiovascular disease, maybe just to manage their blood pressure or their cholesterol, sometimes just for pre and post surgery issues. If we look at gastrointestinal conditions, it could be any of a number of things. Could be reflux, could be irritable bowel syndrome, it could be ulcerative colitis, Crohn's disease, diarrhea and constipation, and you name it, right? So musculoskeletal, back pain, injury-related symptoms, could be osteoarthritis, fibromyalgia. When I asked, when I first moved to a state that had no licensure and I was working with the primary care physicians, I asked them what was the condition that frustrated them the most, because I thought if I can help with that, then that would help to increase the collaboration and integration. And fibromyalgia was the one they said, oh, we can't handle it. It worked to my benefit because then I could integrate. We'll talk a little bit more about that. Neurological conditions could be headaches, migraines, neuralgias, ADHD, memory loss, Parkinson's, autism, disorders related to brain injuries. So if we look at naturopathic practice as a collaborative and integrative care, which is a lot of why I got into naturopathic medicine, because I'm interested in integrative care. You can see that 33% of the people who see an ND only see the ND. And I would imagine that that's in locations where they have a broad scope of practice. 43% see an additional primary care physician, as in the case where I was seeing patients and had no ability to order labs or prescribe. 28% see a specialist. It's probably pretty, I don't know what the statistic is for the general population. I would imagine it's too far off from that. 12% see allied healthcare, and 11% see another provider like an acupuncturist or someone who practices Ayurvedic medicine or so forth and so on. we want to think of integrative care in a way that impacts the patient in the most positive ways. There's so many ways to interpret it, how we integrate from a management standpoint, from a clinical standpoint, what the process is. Again, let me go back to my experience working in a cancer center when I was initially hired. All of the providers that were not medical, surgical, or radiation oncologists were all working on their own. And I thought, this doesn't benefit the patient in the most productive way. So we developed a department of integrative care, bringing in the NDs and the dietitians and the counselors and the acupuncturists and the PT and OT therapists. So the patients were able to benefit from a more timely and more integrative way. I'm not telling the patient something to do that the dietitian is telling them something different. And we took, for example, that fibromyalgia and put on a 6-week course for patients who had been diagnosed with fibromyalgia, because I saw not just oncology patients, but patients out in the primary care scene. So it was an educational process for us and for the patients, and integrated all of those components. So it was a helpful thing to integrate, and I hope that we can continue to pursue that throughout all of healthcare. So just as a quick summary, it's a distinctive primary health care profession defined by those core principles, those core philosophies and principles that we talked about. It includes all the modern and traditional scientific and empirical methods that we find out about the patient, can explore what tools are the best to approach this with. We treat patients from a wide spectrum of conditions and across their entire lifespan. It's therapeutically diverse. You'll find some who really focus on botanical medicine, some naturopaths who do that, others who really focus on diet, and so forth and so on. Generally, I would say most NDs will use 6 or 7 different approaches, not with each visit, but it's quite diverse. And it is one of the most common healthcare professions globally, so we need to keep working on that. And that was a great eye-opener for me, so I appreciate being invited to talk on this topic. And that certainly in North America, but we are the leaders in research in traditional and complementary practices, blending both conventional and traditional together. So that's my presentation. If there are any questions, I'm happy to take them.
Thank you so much. This was absolutely fascinating for me. There is a question in the chat. If you want to unshare your screen, we can.
Yeah, I'm trying to find that
but
right now.
There is a question. How do you treat patients with fibromyalgia?
Of course. There are a lot of typically, my experience is typically somebody who comes with fibromyalgia has many things going on, not simply fibromyalgia. And so this is definitely a case in which we look at the whole person and say, okay, what's going on from a mental, emotional standpoint? That's a big deal. We are not opposed to conventional ways of treating it, but my experience has been looking at the mental, emotional components, looking at the physical. So this is where a physical therapist is an absolute must in bringing that in. That's where I would refer that. But also there are lots of botanicals that can be used to address that. So it's not simply one. I've seen so many different presentations. Depends on the person. So sorry to disappoint whoever was asking the question without more specific info.
It's okay. There's a couple more questions. Any ways to treat or manage type 2 bipolar disorder?
Oh, wow. That's a good bit out of my range of specialty, but yes, it's not, this is definitely an integrative approach that's needed with that particular condition. I have worked with some people with bipolar disorder, but I don't think that my strategies were the most impactful, but they certainly were useful and helpful. So, but again, that's out of my range of expertise.
Fair enough. And the final question, so in the chat is, are there any accredited online doctorate programs?
There are not. There are online programs, but they are not accredited. It's very clear that we need to see and work closely with patients, do physical exams with patients. That's a component of it all. And so I don't think we will see that ever.
Yeah, that does make sense, since you do have to see the person, right? That does make sense.
Right.
Excellent. Well, thank you again. If anybody has any questions, feel free to unmute yourself. And again, I'll just remind everybody that this meeting presentation, which I found fascinating, it has been recorded and it will be posted on our YouTube channel, and all of you will be receiving a link to that recording once it's ready later on this week. Oh, wait, here we go. So when will you have something like this again? I'm a student and very curious about all the likes of learning new stuff. In the same way we do our GLOBETalk series, it changes topics, but we do these every 2 months. So the next one will be coming up in June. So check your emails on that, and you can subscribe to our bi-monthly newsletter and on our email list for these I think if you can send me an email, or it should have been on part of the registration as well. Our YouTube channel, you'll get that link. I don't know it off the top of my head, I'm sorry. But when I send you the link for the video, you can then access our YouTube channel, because I will send the YouTube link. So that's how you will receive that. Yes, I agree. Fabulous job, Dr. Prenguber. Super interesting, really, really fascinating. I'm going to be doing some looking around in my area for some naturopathic doctors as well, see if I can get some of my issues taken care of. So thank you very much.
You can go to naturopathic.org and go to find a doctor.
Fantastic. Naturopathic.org.
Mm-hmm.
Wonderful. All right, everybody. Thank you so much.